My name is John Masson. I am in pulmonary critical care at Morton Plant Hospital. Early on, we had ventilators and we had usual critical care, but these patients were acting differently than other patients. We still don't understand what the risk factors, why do some people get no symptoms? Some people lose their sense of smell or something. Maybe somebody else might get a headache and somebody else dies. 3 of my partners got sick almost immediately. 1 very sick. And at the time, we did not understand how they got sick so quickly. So for me, it was a daily struggle to get out of bed and go to work, because I thought it was just a matter of time before we all got sick. And honestly, it was a fear of becoming sick and leaving my family that drove me. You was scared out of your wits and scared for your colleagues, because most of my partners have young children. And the thing that drove me was keeping them well, keeping the nurses who had to take care of patients well. The health of the team members became, at Morton Plant where I was, became my primary focus. Getting them to understand that they could infect one another and keeping them well so that they could take care of the sick. But I will tell you that it's still really, really tough for especially our nurses that work on a daily basis with very, very sick people. The fatigue is visible. It's psychologically draining. It's the sadness of seeing a patient that you worked on for, several days, sometimes several weeks, and they eventually succumb. It was heart-wrenching. Earlier on, our group initially formed a collaborative with one another to discuss things and how we would handle patients. And then people started hopping on to our Zoom call till it grew into a BayCare-wide collaborative of intensivists. One of the things that BayCare did very quickly was they listened to us. And it went from what we were talking about at Morton Plant as in our collaborative, and it went out very quickly. Any new papers, any new updates, changes in therapeutics, whatever it is, we communicate that way. When I listen to other physicians that work outside of BayCare, you realize that we've been provided for extremely well. In a time of limited resources, we have been taken care of. It's been the most amazing place to work. And as we climb out of the abyss that is this pandemic, we'll do it in collaboration with BayCare. Together, we can conquer anything.